Welcome back to the deep dive. Today we're tackling a really common question, one that probably causes a bit of stress before a doctor's visit. The question is, for a thyroid blood test, do you actually need to fast? We're going to get you a clear answer today, digging into the UK guidelines and looking at sources like Blood Test UK to do it.
It's a great mission because, the assumption is always don't eat anything. And these thyroid tests are so important. They're looking at key little helpers in your blood, TSH, T4, and T3. They basically check if that tiny energy factory in your neck is running too fast or maybe too slow. It's a really critical check in any NHS clinic.
Okay, let's just get straight to it then. Let's say my GP has ordered a standard thyroid test. Using the info from Blood Test UK, what's the main rule here in the UK? Am I skipping my morning toast or not?
Well, this is the big news, and it should hopefully reduce a bit of that pre-test worry. For a standard thyroid panel in the UK, you usually do not need to fast.
Really?
Yep. The general NHS advice is to just, carry on with your normal routine, eat normally.
Wow, okay. That is actually really surprising. I think most of us assume fasting gives you a sort of cleaner baseline result. So what are the actual benefits of not fasting? I mean, why is it better?
Right, and that's the core of it. The doctors, they want a picture of how your body's engine runs on a normal day.
Okay, so it's like checking the car engine while it's actually driving, not just when it's idling in the garage.
Exactly. It gives a much more real world, a much more representative picture of your thyroid function. And the guidance we've seen from experts, including on Blood Test UK, points out a couple of other huge benefits. One, it's just less stressful for you. And two, people are much more likely to actually keep their appointments. The compliance is higher.
That makes perfect sense. So if a bacon sandwich is fine, what are the things that do throw off these results? Because there must be something to watch out for.
Oh, absolutely. And this is really where your focus needs to be, not on the food. Things like what time of day you take the test can have an effect. But the big ones are major physiological changes like pregnancy and, of course, medications.
What sort of medications?
Well, things like lithium can have a big impact. And obviously, if you're already taking thyroxine for an underactive thyroid, that's crucial for them to know.
So the biggest mistake isn't eating toast. It's forgetting to tell your GP about that new supplement you're taking or a change in your prescription.
That's it in a nutshell. A regular meal is a minor wobble on the graph. Those other factors are major speed bumps that can really distort the results. You absolutely must tell your healthcare provider about every single medicine and supplement.
Okay, so let's bring this all together for someone listening. We rely on these NHS protocols. But just to be crystal clear, sometimes you do have to fast, right? If other tests are being done at the same time.
Yes, that's a very important point. If they're also checking your blood glucose or doing a cholesterol panel, for instance, then you will almost certainly be asked to fast. The UK standard is generally eat normally. It just makes health management that much simpler. That really is the essential takeaway. For routine thyroid testing in the UK, the rule is to eat as you normally would. This whole non-fasting approach, which is strongly supported by current guidance, is just designed to make sure you get the most accurate and comfortable test possible.
And that leaves us with a final thought for you. Since we now know that things like your medication and the timing of your test are so much more critical than what you had for breakfast, how much does just knowing these simple logistics before your appointment reduce your overall health stress? You should always, of course, ask your GP for the final word. But knowing the typical UK rule is a fantastic start to feeling prepared and confident.